Good evening, everyone, and thank you so much for coming this evening for the first episode in the series. We're calling it Capstone Cares. Now, movement is universal. Ellarum move pannuvolla, whether they're children in sports, whether we're older adults trying to stay mobile. Adanala, I thought that this would be like a perfect start to this whole series, which we plan to host 2 Saturdays a month, which is the second and the fourth Saturday. Now, little personal story and my tryst with fitness. I think I've been from school and college. I have been exercising. In terms of exercising, I was a hurdler. I was a hockey player. In college, we didn't have all that here in Government College in Chennai. So I got into throwball, got into volleyball, and then of course life happens, as many women will realize. You lose out on continuing all of that. Apri at the poche, and I landed up with problems with my knees because of what I do. I am a dentist and I have been doing dentistry now for 31 years. So, adinala vanda problem la vanda, I decided to get into strength training. I got into strength training. I was actually doing really well till COVID hit, and I had to kind of abruptly stop that. It was then that the inspiration came from my now 94-year-old father-in-law, who swam all the way till COVID. He was, I think, 89 when we forced him to stop. So he told me that your joints will be spared if you swim. And that's how I got into swimming. I continue to swim through the week. And that's why I said my tryst with fitness has been on and off, but much more on than off these days. So the session is all about that. It's about staying active, staying strong, and doing it smart. So whether you cycle, whether you swim, dance adrela, party idhula varadu, but dance adrela, swim pandrela, cycle pandrela, whatever it is, we want movement. And today we are very lucky to have these 3 incredible doctors here who do not just prescribe health, but they actually live it. I'm very pleased to and very happy to introduce them. I will start with Dr. Rajiv Kulkarni. Dr. Rajiv Kulkarni is an avid runner, a swimmer, an athlete, and an orthopedician to boot. And funnily enough, he's one of those orthopedicians that believes that prevention is better than cure. So he doesn't prescribe surgery more than he prescribes prevention. He has run almost 55 half marathons. Half marathons are, guys, basically about 21 kilometers, doctor? Yeah, 21 kilometers, and 2 full marathons, which are 42 kilometers. And he's planning to run on July 23rd at the Chennai Marathon, which is happening. I think you're going to do another half marathon. So his running journey has taken him through Chennai and Pune, all the way through London and Dublin. And he has terrific experience both on and off the track. So he is more than a surgical, an orthopedic surgeon. I think he's here to help people unlock your body's athletic potential, wherever it is. Either Ipo Pandrela, you want to start, whatever way it is, that's what Dr. Rajiv wants to do. I want to introduce Dr. Srikumar. He's an ace maxillofacial surgeon, but apart from that, I don't think many people know this about him. He is a yoga and a pranayama and a meditation practitioner for almost 30 years. He's a cyclist, he swims, he weight trains, and he also has been practicing the art of Kalaripayattu for the past 10 years. In addition to that, he's thrown gardening into his latest, bag of things to do, because he says it grounds him when he touches the soil. Dr. Sneha Sethumadhavan is an academically brilliant, very talented OBGYN. She's an obstetrician and gynecologist. She's been a swimmer and a tennis player through her childhood. And while she has a lot of clinical commitments, including apart from looking after her son, she still manages to mix cardio, weight training, and core training exercises every day. Request you to give them a really big round of applause. Thank you so much for being here. So let's get right into it. How has fitness shaped your practice, or how did you get into it, Dr. Rajiv?
So, thank you for having me here. I would like to extend my sincere gratitude to Dr. Ram and Dr. Aruna and the entire Capstone team for including me in their family. And going on to the question of entry into the fitness, until COVID, it was all fun. As you all know, we had our routines and academic career. Parallelly, all the sports and fitness was going on. But COVID was the time when we all had a reset button, and that actually started the journey of mindful fitness. So how we can, understand our own body, how we can push, when not to push, when to take rest, and that is the basis of prevention of injuries. So this all in my journey of sporting life. COVID was the time when everything started realigning, and then sport or fitness gave me an opportunity not to compete with anyone but to collaborate, because as a medicos and in the medical school we are taught to compete because it's all cutthroat competition and we have to get marks and stuff like that. But then parallelly, when the sport is there in our life, it is never a competition. It is always like a teamwork, and we have to pull the best people. We have to pull the weaker person and let the team win. So that's how the fitness, the sport has shaped up my career. So, and this is it.
Thank you. Dr. Srikumar?
I'm very happy to be part of the initiative. If you ask me, it's not practice. This has affected me right from my school time. That was a time when we used to play, go for tournaments and all that. So there was always emphasis on warming up, doing exercises before you go for your games and all that. But as children, very young, we never used to do that. And once you are in the higher classes, you try to dodge from your coach and not do it. So I was doing that, and for me, the check came when during one of the tournaments I had a low back injury, and then I was almost bedridden for a week. So that's the time when this shocking reality came that okay, if I don't take care of the body and get it ready for the sport that I want to engage in, it's going to have injury. So that played a very vital role for me to keep training, even all through my studies, your practice and all that. So because I knew if I have to work efficiently and smoothly, I will have to dedicate some time every day to keep my body agile and fit. So that's the in short.
Thank you, ma'am, for that kind introduction. So in comparison to Dr. Rahul and Dr. Shri, who seems to be அப்படியே சைல்ட்ஹுட்லேருந்து ஸ்போர்ட்ஸ்லேயே ஊறி வந்திருக்காங்கன்னு நினைக்கிறேன். I'm not like that. If you ask me whether I'd be interested to participate in a PT period or any sports activity, I'll be the last person. I used to swim and to go for tennis classes because my parents put me in it, not because I was interested. I was more of an indoor person, reading, painting, such kind of things. But knowingly or unknowingly, I think those childhood period where I actually used to swim and play tennis, that was almost 3 to 4 times a week. And we also had a rule that we had to walk and go to school. Marathons, participating in marathons was a must where I did my schooling. So I think I was in really good shape. Without knowing, I think I was in a good shape during adolescent and most of my 20s. And then of course, like ma'am said, medicine happened. Get married, have children, and somehow you do not think about sparing time for fitness because you want to take rest, You want to just unwind doing things that you like. Fitness, I think, unless you're really interested, you have to be quite motivated to make that a part of your life. So, how I started my fitness journey is I've seen a couple of people in my family, especially my own father, who needs help. He is bedridden from, I would say, 56 due to a lot of his lifestyle problems. And when I saw that, I felt that when I am 60 years of age, I want to be independent. I do not want to be dependent on others. I want to be able to take care of my own health, my financial well-being, my emotional well-being, and my physical well-being. So I turned 35 this year, and this was a promise that I made to myself that this year I will allocate some time, definitely, if not 1 or 2 hours every day. It should be a consistent effort to take care of my health, and that's an investment. I thought I should do it, not for weight loss, not for looking good, but because I want to be fit and healthy when I'm 30 years older than this. That's how so compared to these two doctors, I would say I'm a recent fitness enthusiast. In fact, when Madam told, can you send a few things about your fitness journey, I have only 3 lines to send. I do not have a huge fitness or sports history behind me. But I have started to like it. I'd say it's an acquired taste. I'm very glad that I started now. Thank you.
That's awesome. That's awesome, Doctor. So moving on, I'm sure we have a lot of youngsters also. So we get jobs, we don't have enough money to pay to go to gyms and so on. And also as working adults, we don't really train to be athletes. We don't have the time. We are not able to think, okay, let us go and train and become all athletic. So how do you think that we can prioritize fitness?
It's a very valid point because most of us have work and the day is very busy. So by the time we finish work, we're already tired, we want to take rest. So the same with me. What I have done is I've started incorporating small things in my routine. For example, I always take the steps. If I have to go somewhere to buy something, I try to walk. Then I make it a point to sit on the floor and have food. Then I make sure that when I'm watching TV or read a book, I will be kneeling down posture, which is the Vajrasana, I would say. Or
In Vajrasana.
In Vajrasana.
Yeah, in Vajrasana.
The term many might not know, so that's it.
Basically, it's on your knees, on your heels. Yeah.
A few minutes in that. And then I make sure I at least have 5 minutes of full squat. Sit, and then I might do lots of, either read, talk at home. So, few of those. There are many more things that I do, and even during work, even if I'm sitting for more than half an hour, unless it's a surgical procedure, I make sure I get up and walk. Have some kind of movement, and this is very simple things that
I remember we were talking about the lack of Indian commodes. இப்போல்லாம் எல்லாமே western style toilets தானே அதனால when we were talking about it, we were saying that nobody is able to sit in that deep squat and actually get up on their own. Very rare now, and I think you had something to say.
Yeah, so in our basic routine when we get up early morning, simple stretches on the bed. We can start with sitting just beside the bed. Try to stretch, try to take some 5-6 deep breaths, then start your day. Whenever we are having our tea, coffee, whatever morning routine we have, we should try and make sure we have it on the floor or whichever position, rather than resorting it to the dining tables or chairs, whichever way we have as a small kid, whatever, because all the secrets are there in our childhood. So if we try to just go back, rewind ourselves and into the childhood, because we all are in our generation, in everyone's, in 60s, 70s, 80s, we all had access to simple routines like sitting on the floor, going out. Back in olden days, even before I was born, I think maybe in 60s or 70s, the washrooms and the brushing area, the wash basin area used to be out of the house. So you come out of the house, out of the bedroom, in the open area, and then there is a tap, there is a water, and then there you have your morning routine. So if we try to emulate to a certain extent, nowadays we all have balconies or some terraces, so we can just try to adjust, modify certain things, tweak a little, and then we can again can start our basic fitness routine. Because I think all musculoskeletal injuries, not even the orthopedic one, but musculoskeletal injuries, muscle pain, bone pain, Kadatavalli, Mudukavalli, Muttivalli, all these things, they start from lack of flexibility. So that is the first genesis. So when the flexibility is coming down, that is when all these prachanayas, they start cropping up. So if we try to again go back to our childhood days, the Malgudi days, then we can we can get some answers over there.
So I would like to agree with Dr. Sri that try to include physical activity in your day-to-day practice. Taking the stairs may seem like such a simple thing, but like Madam was saying just now, I've seen so many people take the lift in Capstone from ground floor to just first floor.
Correct.
So during my PG days, I had my HOD was a 60-year-old male logician who used to climb stairs. When the patient is on the 7th floor, he will start from ground, and grudgingly we used to follow him. But that's become a habit now, because without thinking I take stairs, and I feel that way I'm doing something. I am activating my muscles every day. And I think commitment is really important. How much ever busy you are, understanding the importance of what this could do to you. It doesn't necessarily need to be 1 hour every day, even 10 minutes, 15. Consistency, I think, is more important when compared to the intensity with which you train. It needs to be a part of your daily life. And for women especially, I feel they say that sarcopenia is the new osteopenia. Correct me if I'm wrong. Which means that I think all Indians are so they like walking. The first exercise that they think of is walking, and we also as practitioners, I think we tell our patients keep walking, but that's a cardio, which means it helps us to burn fat. But what about your muscles?
What is sarcopenia? What is osteopenia?
I wasn't expecting a Viva session. I think he'll be a more appropriate person to answer that. He's an orthopedician, sir.
So we use technical terms.
So basically, to make it simplified, the density of the muscle. So muscle is like a rubber band. So if we imagine a rubber band, it has a stretchability and it has some strength in it. So exactly the muscle also behaves like a rubber band. So when the muscle has a appropriate stretchability and tonicity, that is the state of that is not a state of sarcopenia, but it is basically a normal state. So when this tonicity and elasticity starts losing out, that is where the health of the muscle goes down, and that is termed as the sarcopenia. Because sarcomeres are basic units in the muscle. So muscle also has some batteries, some functioning unit, and these functioning units are known as sarcomeres in the muscle, and that sarcopenia term came from that. So if the numbers of these sarcomeres they reduce, that is known as sarcopenia. And osteopenia is like the bone strength. We have seen all the chalks where in the school days we have blackboard and chalks. So when the chalk falls down or it is being hit to a naughty boy who is sitting on the last bench, it breaks. So the chalk is brittle. So if the bone strength reduces down, then it becomes more brittle, and that is known as osteopenia. So the bone becoming like a chalk is osteopenia, and the muscle becoming like a flaccid or an old rubber band is like a sarcopenia. So
Thanks, that was nice. I mean, I think anything is better than zero. To go to Dr. Sneha's point, 10 minutes is still better than zero. To come to you, Dr. Rajiv, you are a sports injury prevention specialist, is how you want to be known. Why? I mean, what is so special about sports injury prevention?
So basically, what happens is everyone is now playing sport, and everyone wants to enjoy sport because sport is like an emotion to each and every one of us. Be it watching, or if we are all into participating, we really love it. But at the same time, the body has to be in tune with that exercise or maybe that event. But if that event becomes an toll on the body, then the injury crops up. And as I mentioned just a few minutes back, that lack of flexibility is all the reason of all these things. So prevention of, first of all, to identify whether any individual is fit to play a sport. That is most important. If he or she wants to continue playing sport or enjoy the sport, then basic flexibility parameters are there. If we address those things in our daily routine, we need not go to gym, we need not go to some fitness centers for that. Just we need to identify those, whichever sport a person wants to play, be it walking, running, or yoga, or calisthenics, or even nowadays pickleball is into big thing. So if anyone wants to play any sport, start the sports journey, we just need to know how their flexibility quotient is, and then from there we are there to help prevent injuries, because we don't want people who are enjoying any activity come with an illness and then getting treated. Definitely treatment is in our hands, it is documented, we are trained for that, but then the entire family's routine enjoyment revolves around that event, and that is not right, I feel.
You'd like to add anything? That's
So, I'm very happy because if I would prefer going to when you say orthopedic surgeon, for a common man, even for me, I think a person who just does surgeries. So a person who's focusing on prevention, healing is a big plus. So if I have any issue, I would definitely come to a person who's got the surgical and the rehabilitation knowledge. I think that's a great combination of skill set, and I think most people do not know that as a specialty. They think it's only this, but you becoming a specialist in this is a big advantage for all of us.
So just a question for you, Dr. Sneha. So we were talking about small rituals, small routines. So if, when you look at women, generally நான் வந்து எல்லாமே பண்றேனே, துணி மடிக்கிறேன், இது துவைக்கிறேன், அது பண்றேன், நடக்கிறேன். I am doing so much housework. நான் எதுக்கு வந்து எக்ஸசைஸ் பண்ணணும்னு தோணும் இல்லையா? நான் இது என்ன எக்ஸசைஸ்? நான் தான் எக்ஸசைஸ் பண்ணிட்டு இருக்கேனே. இவ்ளோ கேலரி, if you want you can wear a watch, I'll tell you இவ்ளோ கேலரி burn பண்றேனே. What do you think about that? I mean, what is your opinion on the notion of housework being called exercise?
So I would say I hear this almost every day. When I always start with lifestyle changes. So when I tell them try to incorporate exercise, I'll say I'm busy the entire day, doctor. Like you said, I'm adu pandren, guniren. But I would say that we won't call that as exercise. That would be exhaustion, because you're not targeting any specific group of muscles, or you're not doing targeted exercise, I would say. Where you're just moving your body to get that work done. You might not be doing it in the right way as well. In that process, you might get knee pain, backache, you might sprain your body. Whereas exercise is a more systematic, targeted approach of moving your muscles, moving your body, which is for fitness purpose. So yes, it's good to do household chores, but you cannot definitely equate it to proper exercise or exercise time. So that's what I would tell my patients, that it is not equal. You may be burning calories, but it might not have any long-term benefits for you.
So just to move on, in the weekends, Sundays, everybody cycling, there is a marathon, there is a walkathon, the whole thing keeps going. Everyone's doing something, and it's of all ages. So to Dr. Rajiv, is this a fad, or is it something that's happening nowadays that's different? Because I don't think it was like that before.
So COVID, actually again, COVID times 2020, 2021 opened our imaginations towards health and immunity. We all learned many new terms, and then that led to group activity, fitness activities, and then we all realized that yes, we need to take out time for ourselves, for our longevity, because we all realized that how important we are for our family first, and then for our workplace, and then for our friends and relatives. So that is how it has begun, and now transitioning from the age of 50 onwards to 60, 65. That is where the trick is, because when we are into exercise, and when Dr. Sneha was also mentioning she was in swimming and tennis during her school days, and then when we are into 60, 65, that is where the mind and the body is not in sync. Sometimes our mind is 30 years back, but our body is not in sync with those changing times. So this is where professional help is mandatory. When to push, when to accelerate, when to decelerate, when to take a pause, when to adjust our routines, and then go forward. So that is where I think this is most important.
Yeah, it's very true, because during the COVID times, I have a patient who started cycling. He told Dr. I'll come along for cycling. Okay, started. I told her, have you assessed your body? I mean, are you okay? No, doctor, I've cycled when I was in school and all that. So she's gone to school. But now it's about 45 years after that. He started cycling along with me, and then in about 4-5 months, he stopped slowly. Then I had to call him, why you are not trying? He told, doctor's all paining, I have that injury, so many issues he told. This is a very important point that you were told that most of us, we would have stopped all these sports or basic, even just normal play activities right from school. But when you have to begin, you don't realize the time that has passed between the time you stop to now. So it's very important that each one of us, if it's a small stretch or just moving your hand is different. But if you're starting on with an activity, it's very important to have guidance and to know exactly what stage is it. That each person would be at a different stage. So that is very important, to have an assessment and to have proper guidance. And then if you have all this, you can prevent injury, you can perform better, and then it will be it's a progression. Otherwise, I find many of them will stop saying that, okay, I started, then everything went south, and I just couldn't.
And if you can, Dr. Srikumar, touch on, what you call the state of being.
Oh, okay.
Because I think as we grow older, we kind of, we have to get more self-aware, if I can.
That's a very valid point.
So since you are a practitioner for a very long time, you can probably shed little light.
Yeah, it's just a simple observation. This is just a simple observation. So this is something that I see when, let's say, somebody's running on a treadmill. They have music full blast into the ear. It's okay. They're just looking for, I just have to get over this treadmill, 20 minutes on it cross, and they're taking the mind off this with music. It is okay, but I feel if you're running, you should be aware what your leg is doing. Even if you're moving your hand, you should be very aware of what is happening in your hand. It might look very simple, but I feel, I don't know whether there's a scientific backing to this. If you're doing it with awareness and proper, you're very conscious of each movement that is happening in your body, I think you burn more calories, and more than that, you gain a lot of knowledge about how your body is functioning. So, I think
that's so true, because I remember use a treadmill to walk, and then I decided my knees started to hurt. I was told, don't do this treadmill junk because inno jasti da aanu tavara kammi agadu. So I remember being told to walk outside. So in fact, Ram was the one who told me, why don't you stop walking on a treadmill, just start walking outside. And I remember my children telling me, you're walking for so long, why don't you stick that in your ears, you listen to your podcast and so on. I said no, but I've realized along the way, and I do this every day, when I walk outside, because I'm trying to clock in about 6 kilometers. And during that time, just the beauty of, appreciating whatever it is. I walk in the evening sometimes, I walk early morning. It's beautiful to watch the sun, it's beautiful to watch the flowers, it's just beautiful to see everything around you. And ever since I've been doing this for a while now, I don't even see the need or feel the need to put something in my ear and, kind of walk. It's just not appealing anymore, if I may say that. With you, Dr. Sneha, so you may have some more insights on, Dr. Raji was talking about this transition 50, 60. So women in particular, older women, we're premenopausal, menopausal, people think we're going mad, and all of that. So some insights from you on that.
I would say still a lot of women who go through this perimenopausal stage and menopausal stage, they do not come out with what they are experiencing because they still think it's a normal thing. But they do go through a lot of changes physically as well as emotionally. And I think exercise and fitness regimen has a huge effect on their transitioning process, both emotionally as well as physically. A lot of patients in their late 45s and 50s tell me that I'm exercising a lot, but look at my tummy, just this mid area, it just doesn't go away. It's so difficult. I don't eat sweets, I don't eat outside, and I exercise every day, but then it's just not going away. So your metabolism,
it's like that ring that you use in the swimming pool.
So your metabolism changes. So menopause is a complete transition in the reproductive life of women, and the way your body functions changes because your ovaries just stops functioning. The good hormones, the estrogen drops. So it's much more difficult to burn fat at this stage. You might not be eating junk food, or you might not be eating more. You may be, I would say, a fairly regular person exercising. But still at 45 plus, it's much more difficult to lose weight if that's your goal when compared to somebody of 20 to 30s. So that's something that we need to remember. Again, strength training is very important even in those perimenopausal, menopausal stage, provided that they are fit. Like, it's good to be assessed by a specialist before we start, because this is a period when they have joint issues, they might be having osteoarthritis or any other cartilage issues. So you need to be assessed by a specialist before you start. Maybe walking is fine, but before you start strength training, I think you need to be assessed definitely by a sports injury prevention doctor to see if that's safe for you. And there's this common misconception that when women start weighting lifts, you start looking like a He-Man or you start developing muscles, but that's not true. It just helps to tone your muscles, but you do not start becoming, or you don't start looking like a men particular or bodybuilder men. And the earlier you begin, the better strength training, and it's important that prevention is better than cure. So yes, if you can start your fitness journey in perimenopause, menopause, that's good. But again, it's really good if you start much earlier in your life, so that when you hit perimenopause and menopause, you are in a much better state.
Okay, so what do you think, this is an open question, what's a common fitness myth or an injury myth that you wish people knew more about?
So for me, so being on both the sides, on one hand, when I run, when I into sporting activity, and when I'm operating on a fitness enthusiast or a player or any athlete, two things. People have a myth that if there is any injury, he or she won't be back to his maximum potential. So I would here like to quote an example of Rishabh Pant. We all know how freak injury he had from his car accident, and it's a near fatal accident. And the way he came out within 18 months, and exactly this is what I'm talking about. So there is in the medical sciences what we have currently, that all these sports injuries are manageable. Number one, provided we are at a right doorstep, and second thing, how we recover from that is again a protocol for each and every person. It's a roadmap. So that roadmap involves a multidisciplinary approach, not even just an orthopedic surgeon or a physiotherapist, It involves a family support, it involves a preventive team, it involves a nutritionist, it also involves a clinical psychologist. So, which all deal with affirmations, manifestations, and subconscious healing. So that's another kind of a very level discussion, to be honest. But these are because of these elements who are accessible to these elite players, they recover very fast. So my intention being having got small experience with all these elements, I want to enhance these things at our level where we can incorporate all these things in a very better way. So this is one myth which I want to emphasize over here.
I think another myth is generally people have a feeling that you go to the doctor only when you're sick. They don't go to the doctor when you're well. So I think that is a very important thing, that when you are well, you can still go to the doctor, get advice on how you have to train and improve yourself. I think that is one point I would like to put across. Seek guidance, go to a specialist, set your goals and see how you can reach that.
And I think Dr. Sneha already spoke about this weight training thing with women. It's in our culture, I think. Naangalla weight தூக்கினோம்னா அப்படி மஸ்லியா அப்படி ஆயிடுவோம், and they say you lose your feminism. I think that's all baloney, really. It's so important as we grow older, especially women in the audience. As we grow older, you lose muscle. So it's very important, I think, that you gain it. If it's weight training, so be it. Now, to kind of come to the end of this session, let's just talk a little bit about people with comorbidities. Comorbidity now, உங்களுக்கு diabetes இருக்கு, hypertension இருக்கு, heart disease இருக்கு, I'm an asthmatic. எனக்கு படி கூட ஏற முடியல, நீங்க வந்து எக்ஸசைஸ் பண்ண சொல்றீங்க அப்படின்னா there is a thing, right? So again to you, Dr. Rajiv, can somebody with comorbidities actually, I know you were talking about somebody with injuries, completely recovering and able to go back. So someone with comorbidities, can they actually have the hope that they can play a sport, or they can run, or they can go back to swimming or cycling or even lifting weights? Is that a possibility?
Yes, definitely. Whatever comorbidities we have, except so only one exception is there: a bedridden individual. If an individual is a bedridden, I only believe that a bedridden person can be made to sit bedside or maybe walk a few steps. So this is what I believe as of now, with all the elements which I was mentioning, in a full support. But ruling out this exception, when we all are having some of the other comorbid illnesses in the society, I feel everyone can enjoy sport, and I truly believe if we get a personalized physiological baseline parameters checked for each and every one, then definitely I can assure you, everyone who wants to have their goals, like I want to run a 5 kilometers, I want to do a 10-minute brisk walking, definitely we are here to help them and reach their goals.
I think the people who have this going on, saying that when I'm fit I don't need exercise, and when I'm sick I can't do exercise, I think
yeah, sometimes I think the diagnosis of the comorbidity prevents you from actually doing what you could do. So you keep thinking, நான் பண்ணுவேன் இங்க படி கூட ஏற மாட்டேங்கிறாங்க நிறைய பேர், ஆனா நான் பண்றேன் அப்புறம் என்ன ஆயிடுறதுன்னா, அப்புறம் ஐயோ முட்டி என்ன வலிக்கிறது மேம் இப்படி சொல்றீங்களே, நான் என்னால ஏற முடியாது, லிஃப்ட் இருக்கா பழிச்சேன்னா. So then you use that comorbidity, or you use the fact that ayyo mutti valikirde as an excuse not to do what you had planned to do even 10 years ago. So are we going to spend the rest of our life trying to say, oh, you know what, this is what it is, I can't do anything? That's quite a sad thing. Dr. Sneha, if you'd like to comment.
I just like to stress on what Dr. Rahul said. I think Dr. Rajiv said that invariably everybody ends up with having some kind of comorbidity, especially diabetes or hypertension, because of ethnicity. But it's important to be assessed and to have a tailor-made program for you. Having a comorbidity is not a contraindication to exercise, but it's better to be assessed by a specialist to see what kind of exercise is safe for you, what kind of exercise, because there are a variety of exercise, and to add to that there is social media telling us you do this, you lose weight in 1 week, or you eat this, and so it's very easy to go for that easy route. And you need to be assessed as a whole before you can dive into such kind of exercise. It's not one fits all, so it has to be tailor-made approach. And if I can add now, I think pregnancy is looked like a comorbidity. You become pregnant and people say, "Ayo, move pannada, bed layer," they get, food comes to you, everything comes to you. They don't want to move even an inch, and then at the end they want normal delivery as well. So I would say one thing that I would like to add is you can be fit during pregnancy as well. There are only a handful of conditions where we advise bed rest or do not do anything that will exert you. And being fit during pregnancy also, it's not just for having a normal vaginal delivery, it's good for you to not develop sugar or BP during pregnancy for your baby's growth, for your mental well-being. That's something that I wanted to add.
And also, just a question to you. Older women, I'm sure you have heard of a lot of urinary infections with older women. So is there something you would recommend for older women that, would kind of help?
So apart from the muscle training, the weight training and the cardios, for women especially, there's something called pelvic floor exercise or Kegels exercises, which helps to strengthen our pelvic muscles. So these pelvic muscles are like a bowl of muscle in the lower part of our tummy, and that helps to keep the organs in the lower tummy, especially the urine bag, the uterus and the motion bag in place. And when these muscles become weak, you experience leakage of urine. That's the most common symptoms, and sometimes the uterus comes down, you might notice something coming down. And pelvic exercise, in fact, they say you need to start when you're pregnant, because the weight of the fetus is what starts weakening, stretches the muscles, and they start losing that nervous sensation. So you start during pregnancy and continue it during postnatal. Again, this is where prevention comes to play. We advocate Kegels exercise when women come to us with urinary problems. But you need to start it right from the time you conceive, postnatal, and continue doing it through your perimenopausal and menopausal period, because that is one of the muscles that's internal, but that's really important for pelvic, supporting the organs in our lower part of tummy for women.
Sure. Yeah, I would like to add on the Kegels exercises. So there was a very interesting study which was conducted by my younger brother way back in 2005. So regarding the prevalence of cesarean section and normal deliveries in rural areas versus urban cities. So in rural areas, we know the expectant mothers, they have no option to sophisticated life, caring families. Their husbands are into the farm fields. They have to carry the food and the water, the mud vessels to the fields, and they have to draw out the water from the wells. So the posture with which a person draws water from the well, they have to first plant their feet to the podium, to the cement podium. Then they have to lean in. They have to compress, they have to engage their core. So this is all I'm talking now from today's terminologies. But when we actually see those, they engage the core. This is what the gym trainers nowadays, they say. Okay, so you bend, 45 degrees, arch your back, engage the core, flex knee. The knee should not travel more than the hip should go back. So all these, sugary terms, when we observe those heroic ladies doing all these things, so that is where again the secret lies. So they never had the chances of surgical deliveries, but they were into normal natural deliveries. So this is where the Kegels exercises again in our own days.
And just to touch on professional assessment, it was interesting when we were having a conversation. Dr. Rajiv was saying, previously யாராவது மாதிரி நெஞ்சு வலிக்கிறது மாதிரியா இருக்கு அப்படின்னா they'll say, oh சரி you better get an ECG. So கொஞ்சம் பயத்தோட போவாங்க, ECG எடுப்பாங்க, பட் எல்லாம் நார்மலா தானே இருக்கு, இது என்னது, they used to be so sad that it was all normal. They were disappointed that it was normal. Compared to nowadays, I think, if you want to just touch base on that.
Exactly. So this is what nowadays people are very happy if everything is normal. Okay, so there are because you all are aware that health is more important. It is a vital parameter for all of us to sustain. But then just before a few years back, maybe 7-8 years back, if normal blood results come, what is the use? We unnecessarily paid money. Everything is normal. There is no prachana. Everything is routine. So why unnecessarily we did this? So
thank you very much. Just to kind of end this, if you all can maybe sum up and give some tip to this audience as to what you think about this and what it's something that you want to say.
So from my side, everyone can enjoy fitness, sport, whatever they want to do at any certain point of time, provided they get themselves personalized physiological parameters checked. Simple things, and it is not a rocket science. And definitely we are here to enhance their journey into fitness, whatever be it, 5-kilometer run, swimming, playing something, or even taking their granddaughters and grandsons to the park and then running with them. So we are here to help. This is what I want to mention.
I would like to say, start early, be consistent, and be safe. Don't exert yourself, like one day do not try to do a lot and then compensate for the other day.
Small steps, consistent ones is good. I would say even it should be very a natural thing that people should incorporate fitness and other activities into their routine, not like an addition. I would say if there's something like an urge to go to the restroom, if there's some urge to start fitness like that.
Thank you, Dr. Srikumar. So just to sum it up, I think injuries are not pleasant. Anything is better than zero. So உங்களால 10 நிமிஷம் பண்ண முடியுமா 10 நிமிஷம் பண்ணுங்க. Small rituals. Let me see how many of my dear staff in Capstone actually start walking up the stairs and walking down. Let me see. And with older women, perimenopause, it's important for assessments. And like Dr. Sneha said, it's always good to start earlier than later. Now, even if you're injured, you can definitely get better. The whole thing rests with if you want to start something or you're trying to figure out enga start பண்ணலாம் என்ன பண்ணலாம் அப்படினா we have help. Please get a professional assessment so you know that you're ready to do whatever it is. Thank you so much for joining us this evening. Basically, the series aims at making this a space for real conversations, the kind that we really wish would happen more often in healthcare. And I hope that this has left you with a little bit more inspiration, little bit more motivation to kind of carry on, move both wisely and joyfully, I think. We will have the next talk, which will be on July 26th, which is the 4th Saturday. For people who want to follow us on WhatsApp, so that you all are informed of what is going on here, do let one of our staff know, and we'd be very happy to make sure that this series will carry on, with today being the first. Thank you so much, and I open the floor for any questions that you may have.
No, I think you can hear me. There's a lot of talk about strength training,
Yes.
especially for women.
Yes.
Even as you grow older, you have to do strength. What is strength training?
So to start with strength training, it starts with first with body weight exercises. So it's so elder boys who are into 18, 19, there is a lot of fad which is in the school. They want to go to the gym and they start wanting to lift weights, because lifting weights is a new dopamine, as they say. So, but to be honest, for kids and boys and girls who have not yet achieved skeletal maturity, that is 20-21 years of age, they should focus on free body exercises like pull-ups, push-ups. That is good for them. But for people who are skeletally mature 20-25 onwards till 80-85, they have to maintain their muscle mass, because muscle is the organ of longevity, to be honest. And there are big muscles, they are basically the boosters. We have seen all the spaceships and rockets go to the space and then come back. So we have seen these boosters which they propel the heavy payload against the gravity. So the same things applicable to us also. We have big strong muscles, right from the thigh muscles, the low back, the core, and the upper body is involved into shoulders, trapezius, so everything. So we have to build those muscles. We have to maintain those muscles basically. Everyone has the muscles, so we just have to maintain them. So that is how the strength training concept is, because everyone has realized muscle is the organ of longevity. That is the only thing.
One more question.
Last question. See, one of the things I see is, as you said, perimenopausal women between 45 and 55, obese, a lot of aches, pains, joint hurts, and even if you tell them, just walk, I'm not able to walk, doctor. So what kind of exercise would you tell them? What would you, on one side, if you tell them you have to lose weight, you have to cut down your diet, the immediate answer is, I don't eat at all. I eat this much of rice a day, one idli in the morning, one dosa or one chapati at night. And I can't believe how one can eat this and then stay the way they are. But that is different. I don't know what happens in between. But the problem is they ask you, either tell us lose weight or make us a little fitter and less achy. What would you advise?
So first, I would like to see if they have any medical conditions.
Let us assume that they don't have any medical
So
issues.
I usually tell them start small. So start with 15 minutes of walking every day, and then gradually make it to 20, 30, and then if possible 10k every day. That's the smallest of thing that you can. I'm not saying maybe over a period of 1 month, but when I tell them start 10k today, they don't do it. So I tell them start with 15 minutes. And when they have joint pain issues, I would always like to make sure that they don't have any pathological joint issues. That's one thing that we'd like, again, it'd be nice to have a specialist like him to assess that. And going to the gym or walking by yourself needs huge motivation. There are days where you would want to skip. So I usually tell them have a group, like a group activity, or maybe have a personal trainer, a good personal trainer. Tell them your goals. How much weight you want to reduce? What are your fitness goals? And have a tailor-made approach. When you have a physical trainer and probably let's say he comes to your house to help out, you need to be there. You can't keep giving excuses. So one of the main thing I find is they keep finding excuses for not doing exercise. They say I don't have time, I have to take care of my older in-laws or parents, or like you said, achy legs. Heavy weight is the reason why most of the time they have knee pain. So I would say start small, be consistent, get professional help. I think good personal trainers really make a huge difference in their fitness journey.
Yeah, I would like to add one point. To this. As she mentioned, from there onwards, two main factors are always a hindrance for any exercise. One is the pain, that is vali, and second is lack of flexibility. So for an obese lady whose knees are paining like anything, first thing to start with basic flexibility exercises for karata, shoulders, forearm, wrist, in the home only, bedside, and then start with some standing stretches exercise. Once she develops a routine, 2 to 3 days of some flexibility stretching exercises, she would definitely feel reduction in the pain. Along with that, there are certain other measures, non-medications, not the paracetamols and tramadols and all, but basic measures like hot fomentations, ice applications, and certain amount of braces support for appropriate joints. So they can, without medications or without maximum medications, I would say minimal medications with more of other modalities, they can start with their exercise routine. And once the pain is under control, flexibility increases, then we can maybe progress onto, climb the stairs, go out of the house, walk around, like that. So definitely this would go a long way. Yeah.
Any other questions? Anybody? Yes, ma'am.
I wanted to know, what is the difference in walking within the house, like you have a big house and you can walk around say 20 minutes, 40 minutes, and walking outside the house where these days the roads are bad, you don't want to reach in the walking path.
True.
So does it matter whether if you're doing that house itself?
Yes, so steps matters when we have a big bungalows, to be honest. Yes, we can actually adjust the pattern of exercises in and around the vicinity which we have. Need not go outside on the main road or on the lanes which are buzzing with the streets or traffic or something. But we can count the steps, number one. If we have staircase inside the house from the hall going on to the first floor, then we can use the stairs as a form of equipment to do the exercises. Like we can, instead of climbing one stairs, we can try to climb the two stairs, like progression. So progression based exercises we can plan out depending on the facility a person has and depending on the ecosystem the person lives. So definitely need not be going outside on the main road. Yes, but the number of steps count. Yeah.
Thank you.
Anybody else? Any questions? Thank you so much for coming and taking part in this. I hope to see you all again on July 26th. Thank you.